Welcome to our channel. Herbs as medicines. Herbs or medicinal plants have a long history in treating disease. Research into the medicinal properties of such herbs as the humble dandelion is currently being undertaken by scientists at the Royal Botanical Gardens, in Kew, West London, who believe it could be the source of a life-saving drug for cancer patients. Early tests suggest that it could hold the key to warding off cancer, which kills tens of thousands of people every year. The herbal extract from the bark of the white willow tree generally does not cause stomach irritation due to other, so-called, non-active ingredients contained in the bark, which function to protect the lining of the stomach, thereby preventing ulceration of the stomach wall. The herbs, have already been invented, they grow easily, they multiply readily, and for the most part, they're freely available. However, herbal extracts can be similarly effective, but are not promoted and are highly underutilized. In addition, rarely are herbal extracts prescribed by herbalists as singles, a preparation which utilizes only one herb. Usually herbalists mix a variety of medicinal plants to make a mixture, which addresses more than just the major symptoms. The fact that the primary or principal herb has active ingredients, which has a specific physiological effect, does not mean the other herbs are not necessary in the preparation. This is a fact seemingly ignored by the pharmaceutical industry in its need to manufacture new drugs that can control disease. Knowing that medicinal plants are so effective, that these plants potentially hold the key to many diseases, are inexpensive and have proven their worth time and time again over millennia, why is it that herbal medicine is still not in the forefront of medical treatments, and is considered by many orthodox medical professionals and pharmaceutical companies as hocus pocus? So you won't miss out for the latest health and fitness videos. Like, subscribe, and get notified to our channel.